Did you know that according to the World Health Organization, approximately 830 women around the world die every day due to preventable causes related to pregnancy or childbirth?
Did you know more than 135 million women give birth every year? More than 20 million of them are estimated to experience pregnancy-related illness after birth.
Did you know that 16 million girls aged between 15 and 19 give birth each year? In low and middle income countries, complications from pregnancy and childbirth are the leading cause of death among girls 15 and 19.
Did you know that the lack of skilled care is the main obstacle to better health for mothers? This is aggravated by a global shortage of qualified health workers. This means that millions of births are not assisted by a midwife, a doctor, or a trained nurse.
These problems are actually the primary reason why the UN created the MDG number 5, which is improving the maternal health. Particularly, this MDG is to reduce the maternal mortality by 75% and another is to achieve the universal access to reproductive health by 2015.
It's important to note that most maternal deaths can actually be prevented through skilled care at childbirth and access to emergency obstetric care.
In this video, we will get to know more about this MDG and understand maternal health in a deeper perspective. To do so, we interviewed an obstetrics and gynecology physician to discuss more about it.
I am Dr. VILLASIS, an obstetrician gynecologist practicing for the last 30 years here in a town in Bulacan. Maternal health is the health of the mother during conception, prenatal, and postnatal period. Maternal care aims to ensure that every woman who is conceiving or is expecting is able to receive an adequate health care, taught the art of child care, given proper nutrition, have normal delivery, and deliver a healthy baby. Adequate maternal health care helps decrease the risk of pregnancy and other complications and favors the delivery of a healthy baby. Therefore, it aims to decrease maternal morbidity and mortality. Once a mother becomes pregnant, it is very important that the mother have regular visits during her entire pregnancy. Antenatal care refers to the visit during her prenatal period or during the time that she is pregnant. The visit is done regularly every month during the first 6 months, every 2 weeks from the 7th to the 8th month, and every week on the 9th month. During this time, they are given multivitamins, advice on proper nutrition and adequate rest and advise them through some special classes conducted on how to prepare them for motherhood. Likewise, several laboratory workups such as the complete blood count, HIV testing and test for sexually transmitted diseases are done, as well as the sugar monitoring to prevent the possibility of gestational diabetes, which is very important to prevent fetal complications. Now, the postpartum visit or the postnatal visit refers to the period from the time of delivery up to the 6 to the 8 weeks after the mother gives birth. During this period, they are closely monitored as to possible complications. Furthermore, they are advised to practice family planning or the contraceptions necessary according to their preference, and advice on how to take care of their babies. I think the government is trying its best to provide an adequate health care to our mothers. This they do so by training more healthcare professionals on handling deliveries, making prenatal and postnatal checkups available in the barangay health units, and proper instruction, making available facilities as to referral system, enough ambulances for possible conduction of mothers with impending problems when it comes to labor problems, to be referred to secondary or tertiary hospitals for further management. The foremost concern that we should focus when it comes to maternal health care in our country are three things. One is the improved hospitals and facilities. This means that instruments such as ultrasound should be available, and fetal monitoring as well. Fetal monitoring devices as well should be purchased and provided in every hospital to ensure that there is adequate maternal care, minimizing and diagnosing at an early stage possible or impending fetal complications. Another thing is to employ more healthcare workers. When I mean more healthcare workers, this involves trained personnel such as nurses and doctors. This will provide an adequate amount of people who can attend to those people with proper training, who can attend to mothers who are in labor and having some problems during their pregnancy and after delivery. The next is providing an adequate field health care benefits to these mothers. Yes, there is a significant difference from the present in comparison with the past years, because now the mothers and mothers-to-be are aware of how important it is to undergo prenatal and postnatal follow-ups, especially if they belong to a high-risk pregnant mother. Number two, they are aware of how important it is to undergo breastfeeding programs, the importance of how it is to space their children from 2 to 3 to 5 years, And now they are aware on how important it is for their children to receive vaccination, which is given every month or every 2 months in the local barangay health units. Furthermore, they are aware that those people or those babies who are malnourished and evaluated by the local barangay health workers become part of the so-called nutritional feeding program. This is a lot different from the past because during that time, vaccinations given to the people is not routine. They have to pay for it. Likewise, no such feeding programs for the malnourished and underweight children. And the limitations, they usually deliver at home, attended by the helots, but now they know how important it is as years go by and how important it is to deliver in a hospital or in a birthing station. Various factors are responsible for the high maternal mortality or maternal deaths during pregnancy. These are first, sepsis. Next is hemorrhage. Another is hypertension related to pregnancy. Another is obstructive labor or difficult labor. And last is the complication resulting from unsafe abortion. We must remember that should there have been an adequate number of doctors and nurses with skills, who can handle deliveries of mothers with complication, maternal mortality could have been lower. However, 60% of the birthing stations only are handled by skilled healthcare workers. 40% of the birthing stations are attended only by untrained or unskilled assistants. These are called the traditional healthcare workers, not capable of handling complications or not prepared of handling problems during and after delivery. This has contributed to a high rate of maternal deaths in the Philippines. Furthermore, the population or the poorest of the population receives only about 75% from the skilled healthcare workers once they go to a public healthcare facility. Another factor that contributes to the problems related to the high incidence of maternal mortality in the Philippines. And I think the government should do something about this.
Educating girls and boys about this issue. Another is, of course, reducing teenage pregnancies, as this is very unsafe for a yet maturing body of teenage girls. Motivate young people to delay pregnancy and achieve higher levels of education.
Ensuring trained at deliveries and better access to emergency and comprehensive obstetric antenatal and postpartum care.
Reproductive health services, focusing on assisted deliveries and family planning.
Protect poor women from ill health and unaffordable cost and treatment.
The results? Between 2003 and 2013, more than 117 million people in the poorest countries gained access to essential health services. 195 million pregnant women received antenatal care and more than 30 million births were attended by skilled health personnel. Countries have also reported impressive results.
There was a 45% drop in maternal mortality since 1990 around the world. Despite significant declines, MDG 5A, which is to reduce maternal mortality by 75%, was not met.
Everyone, especially us millennials, has a critical role to play in improving the health and well-being of women, children, and adolescents everywhere.
Be informed, take part, and help.